Dr. Tsametse Mohlamonyane. How's it?
Just call me just call me Tsametse Mohlamonyane. Or Tsa.
Can't I just call you Dr. T like what we used to call you?
Oh well, I think for you that's comfort, but
Tsa.
I prefer Tsametse.
Do you remember? Okay, firstly, for the viewers and the listeners, this is a doctor turned lawyer turned doctor again. I don't know what's the next turn going to happen, but that's our guest for today. He's a doctor who became a lawyer, a proper lawyer, not just the LLB. He actually practiced and then went back to medicine. Do you remember when we met, Dr. T, or how we met?
It was for me. It was a blessing. It was wonderful.
Yeah.
Because it was that call that you had made from Norton Rose, and there was an investigation that was going on. And at the time, I think I was a chief investigator. So because of it was a high-profile case, we had to mingle.
Yes. Okay. You're describing it exactly how I would have. I'll never forget. Yeah, it was a high-profile case. You were the chief investigator at the HPCSA at the time, right? Well, I won't get into details, obviously, for confidentiality reasons. So don't stress. I'm not going to expose too much. But I remember dealing with you because I was at Norton Rose, private law firm, right? And you at the HPCSA, creature of statute, right?
That's correct.
And I always look at people's names and what's on their signatures, and I see, hold on, this guy is a medical doctor, but he's also got an LLB. And I remember interacting with you on that case. And then towards the latter part of it, I said to my colleagues, hey, this guy's a doctor and a lawyer. Why don't we get him to work here? And I spoke to my people, and I think we also chatted on the phone. I'm like, aren't you interested in doing your articles or something? And then it just happened, within a month or two.
Yeah, I remember during that discussion, I had to no, yes, please, can we
keep it separate?
Can we pause this discussion so that we deal with the investigation? Yes. And once this whole thing is water under the bridge, then we can resume the communication.
Yeah, it's good. I think it's good you put it on the record. We dealt with it very professionally, but yeah.
I don't know what you heard during the conversation, because I didn't know how you captured that. It was actually from the signature.
Yeah, I think, it must have been on your signature or something. How did I figure it out?
No, because you asked me, Doc, are you a lawyer as well?
Yeah.
I'm like, no, I've done my LLB, I've done my PLT, I've finished the board exams. I'm just waiting for my break.
I must have known it because my colleagues will know I do a lot of research. So I probably knew it. I wouldn't have asked you if I didn't know the question, if I didn't know the answer. Okay, but anyway, we've skipped way ahead. Dr. T, where are you from? What was it like growing up wherever you're from? What led you to this path of choosing a few careers that a lot of people look at on TV and think is glamorous, but I guess in reality it's a different story altogether. Take us back to childhood, man.
Okay. What the 2000 regard as
I'm 2000s, yeah.
Yeah, I'm 2000 regard as the grandfathers. One of the 80s, the very early 80s or the beginning of the 80s. Was born in Ntwani, that's Denelton, in now Limpopo. That's 789 kilometers from where we at in Devon. And I was born in the family of 7. I'm the 4th child, the so-called middle child. And both my parents are still alive. My maternal grandmother has been with us. I think she's turning 108 next month.
Wow.
And we grew up as that unit in the village. Then there was that state of emergency in 1986. Then we had to move because my father was very active around that time. So we moved to Marble Hall. And
where's Marble Hall?
Marble Hall is also in Limpopo. When you go R25 from Kempton Park, you drive to Groblersdal. When you get to Groblersdal, then you'll take a 10 left. You go to Marble Hall. It's a farm. It's a farm area. Marble Hall and Groblersdal. That's their main economic activity around that side. Then in 1988, my father bought a property in Ekangala, that's around Bronxspruit.
Mm-hmm.
The Bronxspruit on your way to Pretoria, between Pretoria and Middle and Witbank.
Mm-hmm.
So we moved there, and that's where I think I had just passed my grade 1 or sub A. We call it sub A in Gauteng or the Transvaal back in the day. Then we went to primary school there and high school. Then 1998 completed my matric. Then I went to University of Pretoria.
Okay.
And yeah, I think the first 4 days I was not immediately admitted into medicine. So the first 4 days I was made to go and attend a BSc.
Right.
Then on Wednesday, I'm like, you know what? These guys I think they're going to waste my time, because if Medunsa accepted me, we went walk in at vets and they accepted me, and these guys want me to do this bridging course. Then I called one of my cousin that we grew up with, and I told him, you know what? I want you to accompany me to main campus, to medical campus. And the following day, on a Thursday, I think on Wednesday or Thursday.
This was 1999.
1999, January or February, I think, around there. So we went there, and with my broken English, I got a meeting with Professor Somarekhrey.
Oh, yeah.
She was responsible for students. And then I told her, you know what, I did not come here for what is going on. And I think you guys will be wasting my time if I have to spend the whole year sitting here when my peers are busy dissecting there or doing whatever they do. And I think just out of that, I think it was Wednesday, because on Thursday afternoon, I received a call to say, you can go join your peers tomorrow and do your medicine.
But you took the initiative at least.
Yes, you must go fetch.
But hold on. But so you got accepted into Wits and Medunsa. So why did you still go to Pretoria?
You see, when you come from economically disadvantaged background, you have limited choices.
Yeah.
Now, my father works in Pretoria, and Pretoria is only about 57 km away from home. So if things don't go well, you can always fall back home.
Okay.
Now, from there to vets, it's about another 40 km, and the support structure is not there. When you go into Medunsa, it's another 40 km. So I had to now make that calculation to say, I think this is the best bet. Then I stayed there. My father worked at the South African Reserve Bank, and so it was like CBD versus being in Hatfield.
Okay.
And you either take a taxi there or you walk, whichever way.
And why did you choose medicine? Or was just out of the blue?
No, okay, this is what happened. I think growing up, academically, my father had an influence. When parents are involved in their children's lives and they can tell that this one, his grades are good. And yes, my grades were good. And even my principals, my teachers developed interest. And then around, I think when we were doing standard 5, then we were asked, principal came and asked individually what we wanted to do. And then I said, no, I want to do medicine. I want to become a doctor, because we had Dr. Mahlango as our GP. So he was the only doctor there. I'm like, no. And, the neighbors, teachers, nurses, no, you must become a doctor. You're doing well. Then it also gets into your head that
Dr. Mahlango was the inspiration.
Yes, he's one of those, because he was he was our local GP.
Where is that now? Which area?
Ekangala. It's called Ekangala, yes.
Ekangala.
That's correct.
So you Limpopo, born and bred, huh?
Born and bred?
Yeah.
No,
do you listen to
bred in
Gauteng?
In Gauteng, yes.
Do you listen to Limpopo?
Yes,
I only learned about that recently.
Yeah, you'll be surprised.
I'm
more Maskandi guy.
Okay, all right. You moved to KZN.
No, even Yeah, so no, Licompo is for my 2000. No,
Yeah.
I'm more into Maskandi and the rest of the genre. But when the music comes, because my daughter is 10, and even the cousins, when they play music, you go with the rhythm.
But now, don't they all listen to piano and all that stuff? It's the new generation.
It's mixing.
Yeah.
Remember, Licompo comes on the footsteps of Mapiano.
Oh, is it?
But now this the kids that especially that goes to this multiracial schools, they also have this funny European and American artists that they listen to,
Yes.
and then you learn from them as well.
Everything just gets mixed.
Yeah.
So how was Tux, University of Pretoria's student life?
It was tough.
Yeah.
The first night.
You look traumatized the way you responded.
No, you see.
It's like you're having flashbacks.
Yeah, no, it was tough. People don't understand, and people will there are some experiences that the next person will never even have the privilege of experiencing. My first night at Dex, I slept like a soldier. I did not have anything. They just showed me a room in Bukenote.
Oh, that's by main campus, right?
Yeah. Yes. And then Bukenote residents said you sleep here, and then I think a week later, then I was moved to Kolakte's college.
Yeah.
And then we're only about 4 years into the new dispensation, democracy. Yeah. So Afrikaners were still very Afrikaner, and the treatment was unbecoming.
Yeah.
But you are there, and you are determined not to fail.
Yeah, I went there in 2005 and 6, and I remember thinking, sure, I don't want to be in those main campus residences. It looks hectic.
Yeah, no, it was hectic.
Did you wear a uniform and things like that?
Did we have a uniform? No, I think with us, okay, fortunately, I could not afford, so I couldn't buy those bungee jumpy things or that uniform of theirs. But on Sundays, they would make us, they called us Frame Delenge. You will learn later what Frame Delenge is.
Yeah. What does it mean?
Strangers.
Oh, yes.
So we were strangers who have to wear pink name tags.
Because you were first year?
Yes.
Hey.
Now, for some interesting reason, I think my posture and my demeanor made these other white kids to see me as a senior.
Okay.
So whenever they see me, it's Mohlamonyane, and I'm like, okay, let me take advantage. Then I say Mohlamonyane. And until one time we met, now the real seniors. And while these white kids, African kids, were greeting Mohlamonyane, and now there was a point of confusion on how I'm going to respond. And then this other guy saw me. I think they called him Bram or something. Then he told them, no, but this guy is not a senior. This guy is in your same as you. Yeah. Because I refused to put that pink thing. So
what were you causing trouble there from first year?
I was not causing trouble. I avoided trouble.
You know, to avoid trouble, you just got to do what the people tell you to do.
No, there are things. You see, I'm a black man.
Right.
Not that anybody can mistake me for it. So the initiations and stuff, I went through that when I was 16.
Okay. And
then coming here and being initiated by white kids, that colonial background and the apartheid that we just experienced. People, oftentimes people think the apartheid was a long time ago or that the kids did not. No, we felt it. There were times in my village where the hippos, this... I don't know what the cars are called, the big ones that look like pigs.
Oh, the Caspers and stuff.
The Caspers. Yeah, when they come, they will traumatize you because then your parents, your uncles, everybody runs away. Now we are here with the offsprings of those people, and they want you to do things that they want. I'm like, I didn't come here for that.
Okay.
I came here to study, and I'm doing medicine. So it's tough because it's in Afrikaans. And those generals from one military hospital. They don't want to compromise.
Yeah.
We are 250 in class, and we only have like 48 black folks, and amongst them is also the Indians, and I think we had one or two colored guys. Now, in that 200, give or take, you have both Afrikaner and whites.
Okay.
English.
Right.
But the funny thing that people don't know is that, and as you grow, every now and then you'll be told, don't trust Afrikaners, but don't trust the white people even more, meaning the English.
Is that what they say when you're growing up? Yeah.
Yes.
Yeah.
Because yes, I remember in 4th year, we were 20 in a group. It's 5 black folks, and then the 7 English, and the remainder Afrikaners. Now, when an African registrar comes and he asks Engels of Afrikaans, like English or Afrikaans, when you
thank you for translating for some of my listeners,
because
I know
because when you say it in English, it's different from in Afrikaans. So they want us to choose. He is asking for us to choose in which language he needs to give us the tutorial. Then you see the 8 Afrikaners plus the 7 English, who know too damn well that we don't understand Afrikaans.
Okay.
It's difficult for us. We don't know English. But it's the better devil.
Right.
For us, we were more exposed to it. Afrikaans, even at school, we passed, and because we needed to do it. But when you do Afrikaans in English, you are not doing Afrikaans. So then those white or English kids will choose Afrikaans in support of the Afrikaner kids.
So instead of being inclusive,
then you are left out. They show you, or they tell you that you are not one of us.
And you think it was like a deliberate?
There's history to this,
right?
And I think even this government is taking things for granted. The union building. What is the union building? Right. What does it symbolize? What is that union? It's a union of the Afrikaners and the English after the Anglo-Boer War.
Okay.
It's not ours, it's not by us, and it's not for us. Now, that solidarity, it's there in the DA.
Right.
So when these things happened, even then, you get to realize, some of us, we caught things very quickly. But for those kids who had been to multiracial schools, they thought they were a class higher than us. The psychological caste system.
Right. Interesting.
The villagers and the townships. You are there as the entry level, and then you have then you have those who went to the multiracials. Then you have the Indian folks and the colored folks, and then you have that solidarity of the Europeans.
Yeah. Fascinating. What is your mother tongue then? What did you speak growing up?
Tswana. Yes.
But they used to teach you guys in Afrikaans, eh?
Huh?
They used to teach you guys in Afrikaans at university.
Yes. It was expensive. It was painful. It was cumbersome, to summarize it.
Yeah.
Because you will have there is this prof from physiology and anatomy.
Right.
They will put an arm on the slide there, anatomical arm, and then it's written it's labeled in Latin.
Yeah.
And then he says in introduction, because this is written in Latin, I guess none of us understand Latin, but it's more common. And as you alleviate the majority rules, there's 200 Afrikaners and 48 of you. So ons gaan in Afrikaans praat.
Wow.
For 4 hours. Then get to learn there's elleboog, there's arm, and the antebrachië. Such things for 4 hours, and you can't leave because that is the head of the first year class in general. So you have to sit there, have your time wasted. You also now have to go and buy, the Afrikaners are they say, let's buy a trots.
Yeah, proud.
They're very proud.
Yeah.
And therefore, they also produce their own books. They will go and translate English books into Afrikaans and then sell you those African books as if they have something special. But what they had done, because the African children from grade 1, just like the English children from grade 1 until university, until they do PhD, they don't have the struggle of having to learn any other language. So they translated the English books and put it in context for them and for their children so that they can be easily spoon-fed.
So what did you guys do? You just have to go back to res and figure it out.
No, you have to buy two textbooks because when you're tired with the like, hey, the exam's in 3 days, then you have to go and read the English textbook.
And you could write in English or in Afrikaans if you wanted. Did you have a choice, or was it all English?
No, it's in English. English was there. No, they did everything in Afrikaans.
Oh, so they wrote in Afrikaans also?
Everything.
I'm trying to think if that happened when I was there. Probably. All I remember I think it may be over time, because you started in 99 and you would have finished off around
2004.
Okay, so I had just started in 2006. By then, things were getting a little bit more progressive, but I still remember distinctly where we would sit in class in dental school, and the one half, it was not even an imagined divide. Like where the staircase would divide the 2 halves of the lecture hall, and the one half would be Afrikaans speaking, and the other half would be English speaking. So that would be blacks, Indians, coloreds, and English white speaking people on the one side, and the other side was very Afrikaans. But my recollection is that people wanted to learn in English because it could take you internationally. Whereas if you just limited yourself to Afrikaans, you were restricting yourself to this country. So then it was slightly different in your time, eh?
No, like I'm saying, with us, there was zero transformation. And we faced hardcore.
And were there any allies throughout this 6-year degree?
Allies from where?
I don't know. That's the thing. So what was it? All just white Afrikaans lecturers, everything? Yes,
and the unfortunate part is that at the time the dean was Professor Tanil Mariba.
Okay.
And even after him, somebody else. No, before there was this Dion Duplessis, Professor Dion Duplessis, but his term ended while we were still there, and then he was replaced by Professor Mariba.
Okay.
And few lecturers, black professors from Medunsa also came in, but it appeared as if there was no transformative agenda because they had no influence, or they did not influence. One of those is the anesthesiologist, who is now, I think, is still in HPCSA. When we had morning meetings where there is a intake or the ward round, and in the mornings, you will have the Afrikaners speak in Afrikaans, and for you it's like, no, everything is on mute. And then he conducts the meeting in English, and then there is this other old Afrikaner professor, and then you don't get to gain anything. And anesthesiology is like pharmacology. For us, it was critical, and it was very important for us to grasp what is happening,
Of
because
course.
once you switch on or off that anesthetic machine, the person's life depends on you. Now, when you are in an academic center where they deliberately deprive you of that information or knowledge, then but these are not good people.
So you not did you not think, hey, I should have gone to Wits or should have gone to Medunsa or something? Well, they never those kind of thoughts.
Hey, black don't crack.
Yeah.
You stay the course.
Yeah.
Once you pass your first year and the second year, all that you see is that graduation stands, and whoever threatens your peace to that, if we were at war, I'd say you'd put them down. But we had to put in the work.
But that is so sad, man. Like you are facing a battle every day where it should be the opposite. It should be like a nurturing environment where people are wanting you to learn.
Yeah, no, they did not. They did not.
Did you
Remember-
pass every year?
Huh?
I would expect at least a failure 1 or 2 years because of that.
Again, when you come from where I come from, failure was not an option.
Right.
Failure was never an option. And because I think in my second year I got the government bursary.
Okay.
And my father's work provided a bursary, but it was only for tuition.
Okay.
So the other difference, I think my first year I got NSFAS, then it was called TEFSA. But my second year, then I got the bursary, and I was able to pay my TEFSA in the very second year from the surplus or the remainder of the bursary. And then going forward, then what is important is that you don't want to lose this opportunity, because if you fail, then they take away your bursary, and then you need to walk on your own. This is not Liverpool.
Yeah.
You will walk on your own and then come and catch up. So the failing was not an option, because I left my siblings and my mother at home, and I need, even in my community, you need to go back and say to them what I went to collect, I've got, and this is it. Because then you were a role model at school and high school. Even while you are at the university, then the teachers keep telling them, hey, there was a guy here from here, and he's now studying medicine. So watch the space, be like that guy and all that. Now that pressure is precious on the one hand, and on the other hand, it's a burden, but the burden that you are willing to carry, to say, I cannot fail.
That's fascinating.
And I remember the first year, the first semester. First semester was fire. First semester was lit.
Yeah.
You know,
Chemistry and all that stuff. Yeah.
chemistry and physics
And bio.
and psychology. We had clinical psychology and then community psychology and philosophy.
Oh, yes.
You have that Prof. Antoinette speaking for 2 hours. You don't know what is this guy saying?
Did you guys have medical terminology also? MTL?
Yes,
Yeah. The Latin stuff, yeah.
Yes, that prof, is it Kritzenga?
Oh, yeah.
Yeah.
I'm glad you can remember. I can't remember any of this stuff.
Yeah, I tried. No, because he was also our house father at Hippo.
Oh, of course, Kritzinger, Dr. Kritzinger.
Yes,
yeah, he was a nice guy.
yes,
Yeah, I
yes,
enjoyed him.
Nice guy. So yeah, we did all that. And that first semester was the toughest, because now you have to adjust to new ways of hearing English the whole day and staying in a residence where they want to force you to do things that you are not there for, that you are not even ready. And then there is the issue of the financing of your academics, and the admin, they don't know you, so they will treat you whichever way.
I find it fascinating. You mentioned this thing about getting used to listening to English the whole day. So when you were growing up, what was spoken all the time? Was it Tswana?
No, we're from a township.
Yeah.
We Ndebele, isiZulu, Swati, Xhosa, Tswana.
Did you ever speak English, like growing up?
Venda.
Did you ever speak English? Yeah.
To who? For where?
Never think about this, eh? It's amazing, huh?
No, yes. The interesting part is that our school had English and Afrikaans teachers.
Yeah.
So that was the only time, like, that 30 minutes class, or we call it period. But now once you do medicine, then it means something else. So it was a 30-minute class or 1 hour, do Afrikaans, and then, or you do maths, because our maths teacher was English, and then, no, she was Afrikaans. The English, it's English, and physics somewhere, it was the English, and yeah.
Yeah, look at, I mean, look at, now that
those were the only times where you have to, like,
now,
break your tongue and then go home.
yeah, but now that I think of it, I'm just exposing my ignorance, because I mean, that's probably the case for most people in the country, right? English is spoken in very few centers as a first language, right, in the country. I don't know.
Yeah, English is, for us as Africans, or as South Africans,
Yeah.
let me be more specific, is not
even a second language.
Yeah, it's a necessity. It's like when you want to court a girl and you know that she does not understand your language, then you have to speak that language. But other than that, you revert to one of the, either speak Zulu, Sindebele, Tswana, Spedi, and in Pretoria they've got their own lingo, Spitori, and all that. Yeah. So English was not important, and that is why even here sometimes I'm like, at work, and at some point I was when I was a manager, then we're sitting there, like 8 members of executive, and 7 or 6 are Zulu speaking. I can speak isiZulu, and then there's only one person who does not speak isiZulu. And then once we start the meeting, then the CEO will say, no, please, let's speak in English to accommodate this one. Then I will raise an issue to say, but we are the majority. The KZN has got 80% of Zulu people. So isiZulu is supposed to be the first language. I don't understand why you guys are advocating for a language of the minority to overrule what is democratically clear.
Yeah. How funny is that though, right? Because when you were in campus, it was the other way around.
Yeah, no, you see, they implemented, and I understood that when they say majority, then let it rule. But it's a teaching institution. But here, the 80% or 90% of recipients of public service are Zulu speakers.
Yeah.
Now, why are you even writing or publishing documents in English? Because you are continuing this prejudice and the assumption that Black people must learn other English in order for them to excel.
Yeah.
But yes, after graduating, I never had to speak English with patients.
That's fascinating, huh?
Yeah. The only time, I think, in Far East Rand, or even in South Coast, it was here and there when you have one Indian patient or 2 white folks, very old, who cannot afford medical aid. But at the core, siyakhuluma. So why then, when we're having a meeting, we have now to change? Now we have like a room full of Black people speaking English
to accommodate the one guy.
No. Yeah. And I've always said this: when you speak any of the African languages and you are in a room with 10 Afrikaners, they're going to prat all the way. And I think when you do that, even with the English, they'll do that. With the French, they will speak. You need to. And I'm like, no, but why do we always have to be the ones who are supposed to be flexible? I don't accept that. I think we demean ourselves more than any other thing, especially in provinces where the majority language is known. Eastern Cape is close. It doesn't matter whether they differ in terms of the locality or the Induna or the Inkos, but it's close. When you come to KZN, isiZulu, whether it's from Natal or it's from the northern, it's isiZulu. When you go to Northwest, it's Tswana. But we get into a meeting and they said English. Why English? What is so important about English?
And you made a good point. Also, the funny thing is, if most of your patients are going to be not speaking English,
No, it's your people.
you need to also be able to communicate with your patients, right, in a language that they understand.
Exactly. And that is why, when I did some of my work in the inland, and then you find Indian kids, or let me not call them kids because they are adults,
Okay.
junior doctors,
Yes.
or you have white junior doctors, and then when they conduct their clinical work, they expect the patient to speak their language. I'm like, no, why is this the case? Because you are the service provider. This is the client. Why is it that they did not teach you
I agree with that.
isiZulu,
Yeah.
the language of the client? You cannot expect the client to now change in order to suit you.
I agree with you.
But it's still happening.
And the funny thing is, like, a lot of us are not even ashamed or embarrassed that we can't speak the local language. You know what I mean?
Yeah, we should ban you.
Yeah. I mean, I'm doing Zulu on Duolingo. I'm trying to learn Zulu on Duolingo. But you'll find a lot of South Africans will be quick to go and learn French and Spanish and all these things to travel, but we are not as enthusiastic about learning local languages.
Yes, because that is ingrained in people's minds that Black people are inferior, and therefore they must always come up. When I jokingly said there is this caste
hierarchy, like
we always have to climb a ladder for us to be recognized. Even when we are recognized, there's still people that undermine you. It's not a very nice thing.
Yeah.
But it also takes the political will to change things. And politics is like it's not even a beauty contest because most of them are not pretty. But it's a popularity contest more than brains.
But you know what the beautiful thing is? That soon there's going to be no excuse to not be able to communicate with a patient in their own language with AI. It's amazing that you will be able to without any excuse. Like I can just speak into something; it'll automatically just happen almost on the fly. I mean, Apple are already doing that now but obviously they're starting with a very few languages, but you can get the new earpods.
Yeah.
Where it's called live translate, and you speak to a person, they will have it on also, and the AI automatically translates it as you're speaking.
So now it's like you are at the United Nations Assembly.
Exactly, but you've got it in your pocket. So there will soon be no excuse. I remember when I was doing comms, it probably wasn't even ComServe. It was probably first or second year into being on permanently. There would be this Chinese patient that would come there once in a while. He couldn't speak English or anything. But even then, this was 2011, 12, 13, around there. I would use Google Translate, and the guy would get fascinated, and he would want to only see me, even though I was a junior doctor there, because I could connect with him.
Because you went an extra mile.
Yeah, well, you see, I mean, not because I went the extra mile, but because I think he could just communicate with me. He could understand what I'm saying.
Please don't play that.
No, seriously,
because I'm saying, not all your colleagues were able to creatively find that space to connect, and you were then you became the go-to guy for that person.
Yes, yeah, but then also the more important thing is that the patient can understand what you say.
Exactly.
And you were making the point earlier, why must they learn what you can understand? You should learn the other way around. Isn't KZN doing something like that? I saw it on TikTok recently where there's like, you have to pass Zulu or something like that in order to get any degree now. So there's baby steps or something happening.
Okay. No, I've not seen it. All that I know is that I think most of the universities, especially in the health sciences, they introducing the language of that area. But the intensity, I guess it's something else.
Yeah, baby steps. It's like 30 years into democracy, and we're still at that baby steps phase. Okay, but it'll happen. I think things will change slowly, and then suddenly it'll happen fast. But we'll see. We'll be around to see it happen. I believe. Because people are actually learning now. I mean, honestly, a lot of it comes from ignorance. As you said, a lot of it is ingrained in people growing up. Like, that's superior, this is inferior. I think slowly the 2000s and their kids will learn.
I like those ones. They don't care a damn, and they don't carry the parents' burden.
Yes.
They just do their own thing, and they I think they're more social and they mingle easier.
Yeah.
But I guess it's because some of us, we're still carrying the pains of the past. When you relate to something, you need first to go to
Yes.
your history.
You're saying carrying the pains of the past, right? I never really experienced it until I started working in ComServe, because I'm coming from a place where everybody spoke English around me, and I assumed that, you must know my language. Working in Standerton Hospital, there was an old white lady sitting on a chair, in the dental chair. I walk in, and she turns at me and she says, "Doctor, I'm so glad I'm getting an Indian doctor, not a black doctor." Right? She tells me this straight, thinking like I must take it as a compliment or something, right? And I just got super pissed off with that. And I just said, "Well, sorry, I'm a black doctor," and I walked out and I left. I just left her. And I've told the story at a couple of presentations I give to medical and dental students, and I asked them the question whether what I did was ethically correct or not. And it's interesting to see, there's obviously two views here.
Yeah.
Some will say, yeah, it's good, you did the right thing. Others will say, no, you should have treated that patient. And then we get into this debate where I will justify my actions. I'll say, no, look, it wasn't an emergency. So, and it was like verbal abuse to me. And also, I knew that one of my white colleagues would eventually see this patient and treat her and give her the denture she needed. But that was the first time I experienced what you're talking about, and, where you are seen as other and inferior and, all that kind of thing. And it can really affect you.
No, it does. Like we say, in reality, when you look at how the police or the community control police, whatever they call them, they act when they are confronted with black protesters versus how they act when they're confronted with white protesters. It's different.
Yeah, we've got a long way to go.
You'll rarely have a situation where they use their guns on the white protesters, but they're very quick to use it on their own.
It's ingrained.
So that mentality, it becomes quite clear.
Yeah, even in 2025, we've still got a long way to go. Did you have any good experiences in medical school, man? How was anything like positive?
Yeah. One thing that was positive, I'd say, I think that Professor Gray was, for me, the highlight, the good part, and even the Professor Lindigi.
Okay.
He was the chairman of the academic for the longest time.
He's the obstetrician, right?
Yes.
Yeah.
And because even in my final year, I was working in his firm, and then we discussed this thing. I played soccer.
Right.
I played soccer from my first year to the even final year. I think I was left solo as the final year guy who still goes to play, because for me, fitness and to clear my mind, that was the go-to place. Passing was very important. It was good. And
yeah, well done to you. I mean, anatomy didn't take you out in second year.
No, in fact, we fought. I went to this lecture, because I remember, when we were doing the spot test. What do they call it?
Yeah, where you got to identify things.
Yeah,
right?
we'll that one. We'll sit and see it. We'll score way above the 70s, and then when it comes to now the English and the expressions, then you find that the marks are low, and then we had to negotiate getting that 60% with that guy, and he refused. I was pissed, but I'm like, I'm still going to do it.
No, well done.
So it was living at Hippo was quite nice. You make friends temporarily, and there are friends that are for life, even though you don't speak. But being there was, for me,
Hippo is a senior res, right? It doesn't feel like a res. It's like more like you've got your own kitchen, your own bathroom, everything.
Yes,
not like
the
communal.
privacy and all that. No, it's quite nice.
Did you do like house comm stuff for your haka and all those types of things?
You know,
You did it?
You know, yes. I think it was in 2000. Yes, in 2000, because I got there. There was a fight in 1999, like I told you, with those guys who wanted us to wear name tags.
Oh yeah.
And then I had to be moved. I spoke again with the person who was a mentor, and then he discussed my case with Professor.
Was it not Prof Lombard? Was the mentor? No, Dani.
No,
Do you remember Dani Lombard?
Yes, no, I know.
He was
I know,
good.
I know Prof Lombard.
Yeah.
No, then we were dealing direct. I think Lombard came later.
Okay.
We were dealing with Prof Gray.
Okay.
So they arranged for me to move to Hippo.
Yeah, that was a good move.
Yeah, then it was a good move. And then the following year, then we canvassed for the position of the sports hacker. Then I got that. And then when we went for the project, because, you know, they always give you money for project, then I swayed the committee for us to spend the money on buying sports gears. You know, the Yasir's brother-in-law.
Okay.
Presley.
Oh yeah.
Yes. Then we got them their volleyball kit. We got the netball kit. We got soccer kit.
Oh, you did positive things
from
at least.
there. From that. Yeah, I think the last one they had was ugly and old. So we did that. That year was it was a positive change.
Yeah, I'm glad, because it's a big contrast to my year, because they made me the social haka, and I spent all the money on one party. So yeah, I really didn't. I abused that position, unfortunately. But well, they got what they voted for.
Yeah?
They got what they voted.
Basically. Yeah. No, that was nice. Like, we solving problems here and there. But it was quite nice being at Hippo, and the fact that, you know, the gym. We had the gym there at the medical campus.
Yes.
And I had this friend we were partnering, so we'll run from Hippo all the way to campus, then finish, then come back, then go to the basement, you know, the TV room and all that. So it was
funny enough, you're not the first House Hippocrates sports haka on the show. You know this?
okay.
Capus Khofamodimo is a surgeon. I had him on one of the first few episodes.
Yeah.
He was also the sports haka in my year. Him and I were very close friends. He even gave a speech at my wedding. Yeah, he was a sports haka.
Yeah.
I don't remember him doing too much, but anyway, I don't want. Yeah, he's not here to defend himself, so leave that. So what happens after campus? You then do internship 2 years.
Yes. No. At the time, internship was 1 year.
Okay.
Remember I think for 50 years, internship was 1 year.
Okay.
And they changed to 2 years. Came maybe a year after we left.
Oh.
Because there was a time where your crew, I think the Malifaux crew, they went to protest at HPCSA.
Okay.
Against the 2 years. So I went to Mpumalanga to do my 1 year in Shongwe.
Okay.
And there we also, you know, when we faced with racist, then we battled out. Then I came out safe. Then I went to do ComServe. Then we got there. It was the 4 black guys, and then 4 Cuban guys, seniors. So there was just...
Where was this?
To Groblersdal. Groblersdal is 30 kilometers from my village. It was like I was sent back home, basically.
Wow. And then...
so there was a lot of testosterone.
Yeah.
And
8 guys.
Yeah. So it's 4 Cuban guys, and then 4 ComServe South Africans. And then I think at some point they would test us, send us to theater alone, and with their confidence we will just go there and go in, go out, and everything is done. But then somewhere along the way, then you fight. Remember, there was time in June where there was a confrontation between myself and this guy was a orthopedic trauma surgeon from Cuba. The medical manager was from Cuba as well. And then I'm on call. He's the second on call, is my senior. And there is this person who comes in. I think he had a tractor accident, and then the comminuted fracture of the foot. Now, the principles that you are taught at TIG is, because they said we are teaching you the principles. The rest you'll have to apply your discretion. So the principle is that a debridement of that nature, open fracture, you need to take to theater. So now I'm attending to people in casualties, and then I have this one. So I call this guy and say, "Hey, doc, I have this situation, and this person needs to be debrided in theater." And then he says to me, "No, you can do it in casualties. It's fine." I'm like, I cannot betray the teachings of my folks, because they told us that our people don't know the difference, but it's us who must advocate for them. So I'm sorry, I'm not going to do what you are asking for. Then he started throwing profanities, and then I lost it on the phone as well. I'm like, before you do what you're saying you're going to do to me, I'll ship you back to Cuba.
Yeah.
Yes. Within 5 minutes,
Yeah.
that guy was there. And then
For you or for the patient?
for me,
Yeah.
for me, obviously.
Yeah.
But by that time, I had resolved that if he lays his hands on me, we are in the hospital, so there's no need to call ambulance.
Yeah.
But things are going to happen.
Gosh.
So he came, and then he said, "Come." Then we went into an X-ray, and he went in. Then I stood by the door and closed, and switched combat mode.
Yeah.
Then I think he gauged that, hey, I might have proposed, but I might not win.
Yeah.
So we spoke, and then he took the patient. He did the patient there, but I told him, I'm not going to come. These are my people. And these are my people, and there is no way I'm going to deliberately and intentionally compromise their health. So that was ComCert. Then from there, I came to KZN.
To do what?
HIV.
Right.
Yeah, I started doing HIV 2007 until 2011.
What is that? Like, what are you doing?
HIV medicine. There's an NGO that recruited me around October, towards the end of my ComServe, because I called the province that sponsored my bursary, and I asked them, where am I supposed to go? And because around that time, I think there was this cross-border exchanges.
Okay.
All those areas that were on the border between Mpumalanga or Limpopo or KZN and Eastern Cape, there was a confusion as to what's going to happen now to the institutions, and especially with regard to the bursary obligations. So when they kept quiet, then I told them, okay, fine, since you guys don't know where I'm supposed to be, let me go find myself a job. So I got my job from at an NGO. Then they sent me to Stafford's Post here in KZN. Then I spent a year there. Then I went to Stenga. Yes, I got a promotional post to be a principal medical officer in HIV as well.
In Stenga.
So, yeah, 2008. Then I stayed there just for 6 months. We're getting the clinics and the CHCs ready for rollout, because around that time, 2006, I think 2006 and 2010, people died. Whereas people died a lot between 2000 and 2006. From 2006 and 2010, people now were dying from the HIV drugs, and this is one reality that nobody wants to talk about. People just paint a picture as if there's HIV drugs were panache. They were not. The DDIs, the D40s, the nevirapines, the efavirenz, and those Bactrims, people developed anaphylactic reactions. People literally died. Their lungs, their kidneys, their the levers reacted and people died during that period. But yeah, I think it was my contribution in that field.
Okay, but we went ahead too quickly because I forgot to ask you, when you finish med school, obviously then you go into internship, and I'm assuming that's the first time you start earning money. Was that the first time you were getting paid in your life? Were you doing other jobs on the side?
No, I had never held a job, but my bursary was I organized things in such a way that I was getting enough money through my bursary.
Okay.
But yeah, that was my first
paycheck.
You come again?
So it was your first paycheck, like?
Yes.
And was it pre-OSD or post-OSD? Was it good money or
pre-OSD? Yeah, my first salary, I went home and bought my mother a stove.
I was going to ask you what. Okay, that's cool.
Yeah, it was just because I started working on the 15th of December. Was it 15th? Yeah, I think it's 15th. No, first of December or 15th, because we took an oath on the 24th, on the 25th of November, 2004. And then from there, we were released into November.
And then December, you start working?
December, yeah, we get the beauty of tax of next is that by the last 18 months of the training, you do, it's called student internship, but it is basically internship.
Oh, yeah.
Because we used to see guys who graduated, or the actual interns from UCT and VETs. They were there bleeding people to almost death. Like, what are these guys doing?
Yeah.
So they used to tell us,
look at these arrogant tax guys.
No, it was not. Now it was practical. Because we say no, and then when they consoling us, like, no, look, you can know everything in the textbook, but here's the patient. It's time for research. Then you need to collect tax.
So you think the tax students were the most equipped? Or is it
they back then? I'm not sure about now, because they've been changes. But then you could take a tax student to anywhere.
And how was it, like, your first paycheck? Was it a special thing or not really? Because you were getting money anyway from the bursary.
Yeah, for me, it didn't mean much, except for the fact that now I will be able to do things for my family.
Yes.
I needed to go home, and then for that Christmas, my mother must get the stove, and then she'll bake us cookies. And my father is a chef, so they will start using that stove. And on Christmas, they lay the big table. That's why I've got a big dining table. So.
Now, you're the first doctor in the family, or?
Yes.
Sure. So a lot of people must be collecting from you.
No, the one thing that I did, I think, when we sat with my parents, I said, I know my responsibilities. Don't worry about many things. My first priority is I need to make sure that my siblings get the support in terms of schooling. My father's bursary covers tuition, but tuition is not life. It's the conditions at school that will determine how good you do. So I think for the 5-6 years, I rented an apartment for them, and for last born was in UJ, so I had to pay that. That's because it was later. So for me, that was important, and you try improve things here and there. And the whole of first year, excuse me, I was a pedestrian. Luckily, there was a friend as a dentist. As you guys, you come through all the way to ComServe. You don't have to do the internship shenanigans. So he had a car, and then we drive around month end to go and at least thank ourselves. Yeah.
So you didn't party much as a student, eh? Or did you?
No. I even as a hacker.
Yeah.
Even as a hacker, remember there was this tour, the bus tour, where you go to all the those nightclubs.
Yes.
And I was heavily religious. I'm a very religious person.
Okay.
So I told them, and at my church, on Saturday night, we normally do a virgin. We pray. We go to church.
Are you Seventh-day Adventist?
No.
Yeah.
I was born in the family. My father and my mother is ZCC.
Okay.
And that's how they indoctrinated us.
Yeah.
So you know. Then when this guy said, they used to call me Snipes because we of the exercising and stuff. So and said, "Hey, Snipes, let's go." I'm like,
Oh, like Wesley Snipes. Yeah.
Yeah, I said, no, I can't join you because my brothers at home are praying. Now I cannot be found in beer halls while my brothers are praying and also praying for me to do well. So
Oh, it kept you out of trouble. Religion kept you out of trouble.
You guys can go.
That's how you passed every year. You see.
No, you see, when it comes to school, like I said, there was no room for failure. There was just no room for failure. You'll run around from January until June. There's always freshers, and you always want to try and get yourself a girlfriend, play sports and all that. And if by June you are not girlfriending, then you say, okay, now switch off. Let's secure the buzzer.
Yeah.
Then you do that for 6 years, then you're done.
6 years. 6 years is a long time, and it's hard work.
Yeah,
sure.
It was.
So what happens after Stanger? Then do you?
No, after Stanger, I then, because when
2008.
when you parted with the NGO, it was not in a good spirit. But then I went to even after, I then went to see the MD because they said at the time he was not around. So I went there to see the MD, and we sat down. I made an appointment. And then I think he was told that, hey, there's this young guy that we sent to KZN. We had to fire him for one thing, but they couldn't fire me because I understood the implications, and I knew that you can't send a lawyer to come and manage me. He does not know the terrain of what I'm dealing with. So when me and him were not understanding each other, I think on the day that they thought they were going to fire me, I just gave them the resignation letter, and then the hospital then employed me.
Okay.
So it kept me clean. Subsequent month, then I went because they said the MD is back.
Right.
As I enter the office, then he's a bit obscene. He's a nice guy, but his language is not for people under the age of 18.
Yeah.
So then he says, I can tell from the way you walk in that you are full of shit.
Gosh. Yeah. And did he read your body language correctly or not?
Come again?
Did he read your body language correctly, or was that a misread?
No, I think I came in like gangster, and the American gangsters, long jackets and all that.
Snipes.
No, it was winter, and the reed flake stuff was posed.
Okay.
Cox that it's cold.
Oh.
Then I took a flight. I went there, and then we said, I told him, look, this is what transpired. Then he said, but why didn't you call me? I said, I tried, but I was told that you are not available. Then at the end of the day, we shook hands, said, no, look, if you need a job again, just let me know and we'll make things happen. This should not have happened.
That's good.
Because, the dispute with those people was, I was contracted to provide HIV services to the hospital's clinic and the surrounding clinics. Now, it transpires that while I'm doing that, because some of the clinics are quite far, we'll drive 104 kilometers until single trip.
Sure.
So until you can no longer have network, and keep on asking myself, what happens if I get stuck? Is this what I want for my life? I left Pretoria, I left home, and then I'm in the middle of nowhere going to the end of the world or something. Now, when the staff or the hospital runs short of doctors, they then want this. They speak to these guys to say, can he come and start attending to the patients in the ward? Then I said, it's not in my contract. And when it's not in my contract, I'm not going to do it because I don't get paid for it. And then secondly, in terms of the risk, it elevates the risk because now when you get into the ward, there are also psychiatric patients there. And there are patients whose illnesses have little or nothing to do with the HIV services. So now this is a change of contract terms, and until it's put in writing, it's not favorable for me. And mind you, I just come from ComServe, which means everything HIV I have to teach myself. It was the time where there were initially there was this HIV drug called stavudine.
Okay.
The dose was 40 milligrams. There was a didanosine, that one they had to take off because people were dying. The stavudine also, people were dying, but then they reduced the dose. But the WHO released the document in October, November 2006. So by the time I went for interviews, I was already reading that. So when I got to that place, I said, you know what, people are already struggling. Government has not yet published the reduction of the dose. But what I'm going to do, I'm going to start because I'm not going to wait for government while I see people dying. So I started reducing, and then people started speaking and even checking whether I'm a real doctor and all that.
Oh.
Like, and this is none of my business. I continued with my work. 6 months later, then the government releases the
Updated.
the policy to say that, like, no, okay, I'm ahead of time, so we continue. So after Stenger, there was an interview, the same NGO, and it took me back home. And that for me, it was also a blessing, because it coincided with the economic depression.
Oh, yeah, 2008, around then.
Yes,
Yeah.
yes, and I had just bought the property. It's Stenger. Big mistake that I had to pay for then for almost 9 years. Yeah. So I couldn't enjoy that house and the work as well. It was not, by that time, Stenger was not classified under the rural node. So you had people coming and leaving. Some people never even stayed a week. So me staying for 6 months, it was a gift.
Yeah, to them.
But
Yeah.
the situation was dire. So I went back home. The pay was good. I stayed there. I was stationed in Mpumalanga, it's KwaMhlanga.
Oh, yeah.
2008 until 2010. Then 2010, we were put into a program at Steve Biko Academic, infectious disease. So we worked with the late Professor Stolz.
Okay.
Yeah. So then we were seeing the patients all in the entire Steve Biko Academic who had anything to do with TB and HIV, and then his infectious patients as well. We go to ICU, high care, consults. What we did not do was PEDS because he had said his license does not extend to pediatrics because he did internal medicine, and then he subspecialized then in infectious diseases. I was quite a good guy, and I enjoyed my stay there.
What happens next then?
Then in January 2011, then Ugu, South Coast,
Yes.
they advertise a post for a medical manager. They want to open. Yeah, they had just built. Yes, they had just built a CHC.
Okay.
So they wanted a
community health.
Yes, community
Center.
health center. Yes.
Yeah.
So they want a medical manager. And then, this was 2011. Then I just decided, you know what, let me email my CV.
Yeah. You make it
No.
sound like you were just taking a chance, or you think you were just taking a chance, or what?
Yeah, it was. I'm like, no, let me put my name on.
Yeah.
Then the next thing they called me. I went for interviews, and then I think in March, then they told me I got the job.
Yeah.
I'm like, okay, this was quite interesting. Now it's another level.
Okay. Does it come with like a big salary increase and things like that?
Yes.
Yeah.
Because even at the time, I had moved to Pretoria, so most of the perks or the other things that I was able to do while I was in Komslang, I was not able to do. So I decided, no, let me move. So I moved to KZN. Then there, I think that's where I started learning now the real management, the hardcore management, because when you get there, there are no chairs, there are no tables, there is no staff, and there are services that you need to receive from Murchison to the CHC. There are services that you need to take from Port Shepstone Regional to the CHC, and you need to now go visit all the clinics that pour into the CHC, and you need to get the radiography services registered, you need to get the pharmacy registered, and
so you were like doing a startup business. You were like
from scratch.
From scratch.
It was quite an experience, and it was for me. It was a very nice experience, and it was not without challenges. But I think when I left, I was happy that I'm handing over an institution that could run on its own, because within 7 months of opening that institution, we now had to start 24-hour services. And that means now people have to be on call, and that was a big deal.
So you don't get to do any clinical work in that post at all?
Yes.
Why?
There was a point where I had to get in the back of an ambulance, because with government, they'll bring people who did BLS. And then you have a critical child or a critical patient. Then, like, you know what? If this is the situation, then I need to get in so that we can get to the regional. And at some point, while we waited, I think there was this child who was knocked off by a car, and I was working, so I had to do both clinical and do admin. Now, while I was doing the research, I saw the baby's level of consciousness dropping, and the ambulance is not forthcoming. So I decided, and the grandmother was there. Then I told the staff, you know what, I'm gonna take this baby into my car and get the baby to Port Shepstone Regional, because it's either that or the baby's going to die here, and I cannot live with that. So I drove, but somewhere along the way, then I met the ambulance guys. Then I flagged them. They stopped and they took the baby. And then 3 months later, one of the guys came and they said to me, "Hey, Siyabonga Dokotela, you know that child that you gave to us, then we took to the regional, was actually flown into Inkosi, and then they had to..."
That's Albert Lutuli, yeah?
Yes.
Yeah.
They had to operate and take out the kidney, because the child was bleeding and one of the kidneys had crushed.
Yeah, that child, you probably saved that child's life.
No, that child was going to die there. I'm like,
so you were doing clinical and not just basic admin, like starting up a center.
Yeah, and you see the other challenge with the peripheral institutions, that you get given community service doctors, and they are, just like we said before we started these things, it's a spectrum.
Yeah.
You have people who work, you have people who been dodging since medical school. They were dodging, even now they dodge. And then there are those who are keen but don't have the know-how. So if the comserves are on call, it means I'm also on call. And it takes a toll, because if somebody calls you at 12, you live about 15 to 20 kilometers, because I lived in Margate, and then the CHC is on the other side. and going there is also sort of a maze.
But that's a lot of responsibility. I can't imagine that the salary compensates you fairly for all of those responsibilities. Or did it?
Growing up, in public service, I've always said, they will never pay you, or anyway, there is no employer. As long as you are employed, you will never get paid what your skill is worth. But in public service, for me, I'd say I will always absolve government because I am working for my people. And if I can get one thank you per year, that's more than enough.
Sure, that's a positive way of looking at it.
That's more than enough, because what is it that you expect? This is the government, you know where you come from, and you know that the majority of our people still live in rurals. They are still disadvantaged, and those are the people who need the service the most. And if you can acquire a skill to go and impart, then so be it.
Sure, that's a really good attitude to have. Man, I guess that's what will keep you going, because if you didn't have that kind of attitude, you'd think, well, this baby, why must I take the baby in my car?
Yeah, because the baby will just perish there.
And there are people who just leave the baby, right?
No, yes, there are people who allow people to die in academic institutions. So,
yeah. Well, then again, even in private institutions everywhere.
I don't want to talk about those.
Yeah. That's okay. So that's 2011, 12.
Yeah, 12, 13.
Then how do you end up at the HPCSA? Is that the next step?
No, 12, 13, I went back home again.
Right.
I went to Far East because
what's that? Tambo Memorial? Or?
No, Far East Rand is in Springs. Tambo Memorial is in Boksburg.
Oh, okay.
So I spent 2 years there.
And then, how many places did you live in your life in this country? Can you think of it? Like, genuinely speaking.
Okay, if I have to speak about places, it's easy with hospitals. I think I've worked in more than 12 hospitals now. I've worked in, this is the second mortuary. So I'm a nomad.
Sure, 14 places.
I'm a nomad in a more civilized society, which is kind of difficult for you to move.
Hectic, eh? You've worked in 12 different places, 14 different places.
Yeah.
Okay, so take us then. So you went back to the Far East.
I went to Far East Rand, and then 2 years later, before my baby was born, I then had to move closer to the mother. The mother's in Pretoria.
Okay.
Then I realized she can't move. She's not as mobile. I'm mobile, so I moved to Pretoria. And then 2016, I finished my LLB.
Well, how did you just, in the middle of all of this stuff, you decide to do an LLB? Where does this come from?
Yes, I think like I said, the foundation of becoming a doctor was informed by my grades.
Okay.
At the age of 17, 18, I knew that I'm a lawyer.
Yeah. How do you know this? What were you fighting with people, arguing?
No,
because they get those people say, "Hey, yeah, you like to argue, you should become a lawyer."
No, those, and then the person cannot reason, but they like arguing.
Yeah.
Yeah.
How did you know?
I did debate, but also when it comes to the arguing and the politics and the state and the being an advocate, an advocacy or an activist, I said to myself, this is where I know I will flourish.
Yeah.
But I need to decide now based on my state of the economic state in my family.
Yeah. You need to make money also. Yeah.
Pardon?
You need to make money.
Yes. No, I said, no, you need to firstly secure a job.
Yes.
Then I said, between LLB and medicine will get me a job. I won't have to immediately you move out of the medical school, you go straight into a job, internship. From internship, it's a ComServe, whatever that comes, bursary. The job is secured, it's medicine. And then there's also prestige that comes with the title of a doctor.
Yeah, the status, yeah.
Yeah. And then I said, if I go that route, because the results are there, I think I am capable, then I can pay for my LLB and I can decide whether I want to go write an exam or not, because with one locum, I can pay the tuition. So
Yes, yes.
if I'm tired, I just don't go and write.
So you knew it was a plan. It wasn't like an accident that you got into this LLB thing.
No, no. This was planned. I think the execution was a bit one that was haphazard.
Yeah, but that's going to happen.
Ultimately,
That's
I
natural.
said yes. Ultimately, I'll do it. I remember in my one of my theater days with Prof. Lindig, he asked. He's actually the first guy to call me Tsa, because he asked me, "What is your name?" I said, "My name is Tsametse Mohlamonyane." I said, "Hey, so I'm going to call you Tsa." Said, "Prof, please don't butcher my name. My name is Tsametse Mohlamonyane. You know where we come from."
Yeah.
Then he said to me, in America, the one with the money makes the rules. So here, I look at things, I'm the chairman of the. He never really said that. He just said, but you can tell, like, I'm the head.
I make the rules.
I'm the head of the department. So if I call you Tsar, then you are Tsar. So for a moment, then he asked me, "So what are you going to do after this?" Then I said, "I'm going to do LLB," and he was pissed.
Yeah. Well.
So all these 6 years, I am training a politician. No, I said, no, I'm going to do law, because that's where I know my heart is. This medicine, I can excel because I know how to apply myself. But that I know I must, one way or the other, I must achieve. I can come back and do ONG because it's one of my passions, but I will not die without having an LLB. So,
so what, you studied through UNISA?
Yes.
While you're working, while doing all this stuff?
While
traveling and everything?
Yeah, going up and down.
How was that?
It was tough.
Yeah.
It was.
When was this around? Which years?
I started. I know.
Yeah.
I started 2006 and 2007. 2007 when I moved to Stafford's Post, Rithflay, and I did not register.
Okay.
Because now this is a new environment.
Of course, yeah.
I have to learn this HIV thing, and then I registered again in 2008. And then 2009, I think I did. Second semester, I did not register. 2009, I don't think I registered. I don't remember registering 2009 and 10. And then 2011, I moved to. Then I think I registered when I was here. Then I had to, when I moved back, did I register when I was? No, I don't think I registered.
But I can totally understand this, because you've got so many other things going on. I used to always wonder how people can handle a job and study at the same time.
Yeah.
I had it easy because I used to take leave. I used to use my annual leave to study, and I worked 8 to 4. No,
I had to fight some of the HRs with regard to that. When I have to go and no, I'm entitled to study leave. And the fact that you guys don't understand the relationship between law and medicine, it shouldn't really be.
You see, I had
my problem.
My manager motivated for me, and so I had a supportive manager.
No, me, it was a struggle.
Yeah.
In Far East, yes, I remember. I think I did try. I did write in because there was a campus, or a satellite campus in Binghamton.
Yes.
Yes. So in Far East, I got a support, because the clinical manager was once my comserve, and then the CEO, we from the same area, so we got to understand each other, so it was easier. But here in South Coast, it was a struggle, but I got my way.
And you ended up with the LLB, 2016?
Yes.
Around then. Yeah. Did you ever come across my study notes? You didn't? Yash 0505. I used to have really famous study notes. People would email me and thank me from all over the country and Africa.
I used
to just do questions and answers.
Yeah. No, me, I faced UNISA head on.
Yourself, yeah.
I faced UNISA head on.
And then so what the plan was to become a lawyer someday, or just get that LLB and have it there in case you need to branch off? Yeah.
No, I needed to go full Monty.
Yeah.
Yeah.
How did you get into HPCSA? Where did that come from?
And 2018, then I get a job again in South Coast. Now it's
sure, up and down, eh?
in Murchison. Yeah, it's nice. Yes, I'm like, when I look at people who,
do you just get bored or what?
Yeah, my energy and my ability to survey and understand the environment requires, I can't spend more than 5 years in one place. I'll get bored. I know I'll get bored. So when in 2018 I got that managerial job, it was a quite interesting one how I got the job, because I was here, applied for a job there, and when they did not call me for interviews, when you qualify for a job, you have everything, and they don't even call you for the interview. Then I called.
Okay.
It turns out that the day that I called is the day preceding the day of the interviews.
Okay.
And they said, no, the interviews were yesterday. I'm like, it's not possible. How is it that I was not shortlisted and yet you had the interview? Yeah.
Confidence. That's confidence, yeah.
What
there's throughout your story that you conveyed to me so far, I mean, I've picked up that you're a go-getter. You go for it. You don't just leave opportunities. That's an important trait to have, I think. Where do you learn that? Who teaches you this? Or is it just...
I'm born from the family of 7, and we know where you come from, and we realize that you need to go out there, go get the money, go get the dough, so that you can make a difference in your mother's life, and by extension, her children and all that. So, and we live different lives. There are people who's in their entire life they have zero struggle.
Yes.
And
everything's handed to them.
But the moment you realize that this is not my life, and I have to push, then you just do it. It becomes second nature.
It's amazing, yeah.
So with Murchison, after I called, then I told them, no, please send me the CEO's email address, because now I need to lodge a dispute. And there was an acting CEO at the time. And when I sent the email, a week later, they sent me an email back, and then they confirmed with the call to say the process has been aborted, so it's going to be started afresh.
Because somebody was asking the right questions.
So they started the process afresh, and then I got appointed.
This is a great lesson here. Like, if you don't ask, you don't go out of the way. I mean, that's quite a drastic step you took. You didn't just say, hey, why didn't I get called? You said, give me the CEO's details. Let me write to
them. Yeah, because you have to show, of course, that you mean business.
Otherwise, you sit back and life can just pass you by, hey?
Yeah.
You wouldn't have stayed at, if you just sat back, you wouldn't have been at Tux. Or maybe you would have eventually. You would have done the BSc.
Yeah, it was going to take longer
there.
Yeah.
Here. Okay, so then you get that post in 2018.
2018, I started in August. I did not get the salary August, September, October. I got my salary in November. And
why?
I did not even get my overtime. When I get there, in 2016, there was an incident. Actually, where in Pretoria West, there was an incident where I arrived, I think, in August 2015. Then there is this junior doctor who in January gets charged for the death of a maternal case.
Charged by who?
The hospital.
Okay.
For negligence and for not being there.
Or like an internal disciplinary thing.
Yes.
Yeah.
Then the guy comes to me, and when I look at his things, he asked me for me to represent him. Then I said, no, it's fine, I'll represent you. Then when we start, then I tell the chairperson that I need the records, the clinical records of this patient that my client is being accused of neglecting and all that. And I think we had 3 sittings before the chairperson lost his mind and told the employer that if you do not give this person the clinical notes, then I'm not going to abort this thing, because he has a right. If he has to represent this person, he has every right. Then when I just 3 minutes glance at the records, I knew that the nurse that is their star witness is the one that killed the and this guy was nowhere near when this person died.
I mean, where do you learn? They don't teach this at UNISA. I can tell you
That is why I said it's
in you.
There's something that is a gift. It's there, it's with you, and you just need, the fake sangomas and real sangomas. People who are born with seeing things, and people who go to training and they come back, they become lame duck.
Yeah, you've got it in you to support people, just in general, because you're talking about patients, but this is now a colleague or a doctor. Okay.
So I got fired,
right?
Because after the trial advocacy, practicing trial advocacy without even knowing that you're doing that. During the disciplinary hearing, they present, and then through cross-examination, then this nurse is sitting there, and then I take her through the uses of pitocin.
Okay.
Pitocin is the drug that they'll give you to get the contraction strong, or when immediately after you have delivered, so that the placenta can come out.
Okay.
Now, one of the contraindications is to use it at late in pregnancy, and the second one is if you have had a cesarean section, or if the baby is big, or there's what we call cephalopelvic disproportion, that the baby will not be able to go through.
The head is too big for the
passage. Yeah. Yes, to go through the passage.
Thank you for dumbing it down for a dentist. I appreciate this. Carry on, yeah. Thank you. Thank you.
Yes. So then I read the notes, and I gathered this is what she did, because it's there in black and white. Then I had to now take it through like I was interviewing Shamila Batohi. Then at the end, and when I summarized it, I said, okay, you are a midwife with years of experience. You are having this patient who has a previous Caesar. You called the doctor, and then the doctor gave you instructions, and none of those instructions had anything to do with this drug. And then towards the end, the doctor's shift ends, and the new doctor comes. You then decide on your own, and against the nursing council, against the medical advice, against the drug itself, precautions, you infuse a drug that then makes the contractions even stronger. And those contractions resulted in the baby kicking the uterus open. And then it took then, because of you created an emergency that was not supposed to be there, it took about 3 to 4 hours to transfer this person from Pretoria West to Kalafo. The distance between Pretoria West and Kalafo is about 15 kilometers. And like I said, I've put people in my car to that distance so that we can save life. So this person died. I said, the doctor was not there. You were there. You did everything that you were not supposed to do to ensure that this person dies. And whether or not you had intention in terms of the law, you were very negligent, because you know the outcome of what happens if you infuse this drug in a patient who's having a CPD and the patient died. So I don't understand why you are accusing this poor junior doctor.
So how do you end up getting fired for this now?
No, now there is a murder case.
Yeah.
Now a murder case, you need to report. I struggled with the decision for a while. Then one day I decided to go and report the matter. Unbeknown to me, the station commander and the CEO of that hospital are friends, in speaking terms.
Okay.
Then they ended up not even opening the case, which is something that. But remember, murder cases don't expire. So maybe one day when I'm in pension and far away, we'll visit that. But then when I opened that case, then they gunned for me.
Okay, yeah, no, that all makes sense. I join the dots now. Yeah.
So at the end, and then we had a very messy DC, where then the chairperson showed hand of his biasness, and I'm like, but you quite biased. And at one point he made a decision, a wrong decision, and then when I called him out, he said, no, I cannot review myself. Okay, it's fine. Then we started again, and then I made him now to stick to his word by, trial advocacy again. And then this time around, when I showed him that, no, yesterday you said you cannot review your decisions. Now we are here and this is what is happening. You need to stick to the guns, and then you're going to have to deal with this matter. Then he reverted. So no, I'm changing my decision. I'm like, you see, for me, this thing has been caucused outside to say you need to get rid of this guy. And I don't think me sitting here listening to this is good for my health. You might as well just do it without me. So I walked away, and that walking away, obviously, that it means they made their whatever decision that they made. And we had a tough then 2017 resting. I think, was it August 2016 when the new regulations came, public service regulations. So after a year, then I was eligible to reapply.
Okay.
Then I applied. The struggle was that by that time, because after a year, the department that had locked your PESAL, they need to then lift the ban or the lock so that you can be readmitted. I came for interviews for forensic medical officer post, and unfortunately I didn't stay long there. I stayed for 5 months, but within a month, things fell into place, because again there, at 7 we have to have a meeting. I think on Mondays, if I'm not mistaken, with the exco, and then but on daily basis there must be a handover. So as a medical manager, then I have to chair those meetings. And people will come at 10, 15, or 30 minutes late into the meeting. And then when they get there, they want to understand everything that happened the following Monday. And then I said to them, look, guys, I arrive here at 7 because I'm a manager and I need to know things before you guys know them about the previous day. And I noticed that there's a difference in terms of the arrival time. Then the old folks that I worked with back in the day, I asked, we're sitting, I think, about 20 doctors plus 21 doctors plus 2 clinical associates. I went to each and every person. I asked, who in here does not know or does not have a copy of their employment contract.
Mm.
Do you guys have copies of your employment contract? And it turns out most of these doctors that the general public think they are smart and all that don't know all the facets of life.
Yeah.
So then I told them, please, I need you all, everyone, to get a copy of their contract, because tomorrow morning we are going to talk about the contract. The following day, then I asked the most senior, one of the senior, not the most, asked them, Doctor, what is what does your contract say in terms of your arrival at work? What time are you supposed to be here? And she spoke softly, like, no, please use the confidence. You know why we know each other, so please tell them. It says 7:30, and then Dr. 7:30, and Dr. 7:30, and then Dr. all of them. Then I said, if all your contract says you have to be here at 7:30, mine says I must also be here at 7:30, but because of my responsibilities, I come in at 7. Now that means I will not have any other person coming after 7:30. We don't have to agree. It's your contract.
Yeah, you've agreed already.
Yeah. There's a one junior doctor was doing ComServe. It's actually 2. There was a doctor, and Dr. had been in the that Cuban program.
Okay.
And then this he was just fascinated by this new guy. And then we had just then when I told them there is a legal concept that is called pacta sunt servanda. And then after the meeting, this was they asked this one because she did Spanish. Then she explained to them. I said, no, pacta, it simply says you must do what you said we're going to do on contract. And that's all. So the following 3 days, we were having more people coming on time, and then the resistant team was still coming at their own time. Then on Monday, after the Monday meeting, as people come from 7:45, those who were coming, I said, please don't come in, just stay there by the door. So there were like 4 or 5 people now standing there, and the most senior, she's retired, and doctor, she was there amongst them. Like, no, please stand there. The meeting is in process. Please respect the professionals. Then once we are done, then I had to address them like, no, okay. You guys were not here on time. You can see yourself. I know you. Before end of business, I want you to write to me the reasons why I should not charge you. And there was a panic.
Yeah.
There was a serious panic. And then these other ones were just laughing. Say, hey, who's this guy?
This is the guy that they said, we need somebody like you here.
Yeah, that's what I'm saying.
That's what they meant.
I don't know. I don't know what they
Well, that's clearly,
they knew. Yeah. So then after that, they scribbled. Then, but the subsequent Monday, I think that week I also told them, why do you guys wear formal, look so pretty sharp and all when you come for interviews?
But
I didn't even go to the bat
because
they already knew because they looked at themselves like shambles. People are wearing All-Stars. People are wearing soccer T-shirts. I'm like, how do I distinguish between you and the visitor and the thug in a hospital setting? Then I said, you are either going to, because you are professionals, that one we don't have to need to discuss because you know. So you are either gonna come looking like you are coming for an interview because that is the impression that you made on your first day, or you are going to wear smart casual. I don't want sneakers. No one is gonna come here wearing All-Stars. This is not a shebeen or a tavern. No jeans. Jeans are to work in the farms. No jeans, no sneakers. And ladies, please understand, I'm a man. And this thing of me when I'm standing next to you there by the sink and I see your cleavage and I start salivating, it's not on, because there's going to be issues of sexual harassment. I don't want that. Please mind your cleavage. Don't tempt us. It's okay. We respect you. We love you, black women and all that, all of you. But then some they raised complaints. Oh yeah, this guys that I said they helped me a lot. Then said, but boss, you know this thing that you're asking of us. Hey, our wives are going to laugh at us. They're gonna ask what is happening, and we need time. Can we at least be given a week or two to get our wardrobe in order? Because me and we still have to go and consult. And I'm like, no, it's fine. You go, but a collarless t-shirt is not for work. It's for something else. So if you want to be smart casual, you can wear your golf shirt, but there is no coming to work wearing your soccer t-shirts. Please respect those people. Those people,
The patients.
yeah, they respect you a great deal. They might not even be in a position to contribute tax-wise, but these are our people. There is no one else who's going to show them that respect. The prestige that comes with this profession is dwindling, but for the time that I'm here, please understand that this is going to be the way.
So you explain where this is coming from. It's like to respect the patient, not because you want them to dress a specific way, because you like it like that.
No, I said we are professionals.
Yeah.
First and foremost, we are professionals, and the respect that they give us, we must earn
and reciprocate.
Yeah. So
okay.
Then I ordered. I spoke to the CEO, spoke to the stores person to say, can you please get us the white coats?
Wow.
Everybody gets 2 white coats.
Wow. Okay.
Yeah. Then I went to pharmacy. Pharmacists are always more than doctors. So you go to pharmacy. There's a giant Indian fella there. Very nice guy. You know, when they always say giant people are always the nicest. So then I forgot his name. I don't think this is reflects good on me. But then we sat down, and then I said, I need to speak to you. Speak to him and his second in charge. Then I need to address the staff. Then from there we go to rehab team. I think the rehab team were 18, the pharmacy 31, the doctors 23. So we go to those units that I'm responsible for. Then I tell them, okay, this is me and this is how we're going to work. Oh, and then there is dentistry. I don't know why they put dentistry in the back of the everything's like
to avoid
guys, when we are done eating, we'll come and call you. So then, I introduced myself. Then I'm like, okay, we need to form a committee where we're going to sit, and on every Friday, you update me on your work. And I need to ensure that rehab is fully recognized, dentistry is fully recognized, because most of the money goes to the doctors and the pharmacy. But these engines that are being ignored, we need to bring them forth. And the guys were very appreciative.
Okay.
Then we worked. And then there is this thing of HPCSA.
Yeah, how does that happen?
I'm trying to recall whether the advert was sent to me. I think it was sent to me by the former, I think at the time he was still the General Secretary of the South African Medical Association Trade Union.
Oh, Samatu.
Yeah, it was not yet Samatu. We were still fighting tooth and nail with SAMA to release it, the trade union from that organization that they had created.
Right.
Then I think I was on call. I was post-call when I went for interviews.
What was this post now? What is the position that was in being
chief investigator?
Yeah.
It's the first time that I think in 2018, the 2017-2018, council had resolved to commission a company to review the structure. So now they were filling the new structure after it was approved by council. And then the resolution also was that they need to now appoint healthcare professionals, because it's quite redundant to appoint a non-healthcare practitioner to investigate health practice things. So that's how I applied, and when I got there, guess who I found in the interview? Professor Lindig.
Oh,
I mean, this is 2018. He's seen thousands of students before, but I told him.
do you remember you?
No, he didn't.
Okay, yeah.
No, and I could see my excitement was just mine.
Yeah.
But before they even addressed me, because I was excited, then I said to him, of all the people, may I greet my prof? Then can I please remind you that in 2004, when we're operating on that old lady with pyometra who ended up demising, you asked me what I wanted to do, and I told you amongst the degrees, I need to go and do an LLB. Guess what? You are here interviewing me because other than the medicine degree, it's this LLB that got you interested in seeing me. So you see what I told you, that it might have not been within your catchment at the time, but it's important.
Yeah.
So I'm here. Then we said,
that must have really hit him. Yeah, it would have sat with him.
To say sometimes your reality it's not reality for everyone, and the focused as well. You might be in a tunnel, but some other people's views of life goes this way.
Broader and further ahead. Yeah.
Yes.
Yeah. So how was that interview? What was
the interview?
Now explain, Prof. It's Prof. Lindiki, right?
Yes.
What was his position there?
He was the member of the board
of the medical and dental board at the time.
Yes.
And they have to interview all the candidates for this chief investigator.
Yes.
And when you saw this advert, were you immediately like, I want to do this? What was the role?
In my head, I said to myself, I most of us don't know what is happening at HPCSA. And if I really have to be good at this legal practice, I need to go and see what those guys are doing. The salary was low, but I said to myself, I will negotiate.
Yeah.
So the questions, some of them they were, I think one or two, I couldn't answer proper. But when people know that he might not know, but he's got the brains and the material to quickly discern, then understand the area. Then
and the right attitude, I guess. Yeah.
Yes. And then I got the post, and there was an impression, though it was not in writing, that we will be able to negotiate your salary when you arrive, because I said, I don't want much. I just want you to give me what I'm earning here in Murchison, because for me, that will be able to sustain my life.
Yeah.
And I went there, and then things did not work out that way. February, make inquiry. March, you make inquiry. April, you make inquiry. Then you realize there is an element of corporate psychopath in this environment. And you now need to find ways of dealing with things, which is hard if you understand the corporate psychopathy.
Yeah.
It's a branch of psychiatry and psychology that is very difficult, that is very destructive, and you don't want to find yourself managed by such people at any particular point. But I was there, and then I started lodging grievances, because I'm like, I cannot be speaking to the same person about the same thing over and over again. One of the points of dispute was that the new structure, the council had issued a mandate that the new structure must be populated, and the position of the ombudsman was now changed to the chief mediator.
Oh, okay. Was it already then that it was happening? Yeah.
Yes.
Yeah.
So his contract was ending on the 31st of March, meaning that from 1st of April, then the name change, it must be the chief mediator, and the salary is the same as that of chief investigator. Even though when you look at the regulations are clear. The chief mediator's job is to deal with less serious matters. Yeah. It's issues that you can mediate.
Yeah. Minor issues. Yeah.
And then to triage. So even giving him the salary of the chief investigator is a bonus. Yeah. Because the regulations themselves, they say this one, all that you do is to triage and mediate the dispute between doctor and patient. Yeah. Then the most serious matters then need to be referred to investigation unit, and I'm the chief investigator there. And I've got the senior investigators and the investigators under my arm. And now there is the office of the head of division that now is manned by Mrs. Joyce Mabasa. At the time, this Ombud was acting as that head of the division. But in terms of the policy, then you cannot act for more than 6 months.
Okay.
And then him and the head of legal, they then started going astray. I was appointed to act as it's required, but within a month, then they did the acrobatics. Okay. And they put this guy back in that position. And I said, but this is illegal. You are going against the policy, number one. And I think in one of my investigations, I'm not sure whether I was here or I was in Mpumalanga or Limpopo doing the investigations. Then this guy then boasts to them that he is earning over 2 million. I'm like, a mediator who does not even do the bulk of the work. How is it? Because on the structure, the salary is less than 1 million. Now, no, it's way less than 2 million. And if we are in terms of the structure, the weight on the structure is that we must earn the same money, and his salary cannot be reduced. Then I must be elevated. That became another point of dispute with these two guys. And the way I saw things, I realized that I'm not going to win. But now I need to formulate a strategy and a way out. And then I started writing my formal grievances. And then they went at the level of, because we are both reporting to the guy from the legal services, the head. And I don't know why, but when we're adults and you treat another adult as if it's your child, and they became quite condescending, and it worried me. But then I realized what was at play. I'm like, okay, I need to do what I need to do, because then there must be a trade. Then when they thought the matter was resolved, I said, no, there is no way you can resolve this matter this way. Then I escalated to the office of the CEO, who was new. And unfortunately for him, he listened to whatever they said. I don't know how the guy got appointed, but there's lots of politics at the HPCSA that makes it dysfunctional. So had my grievance, and then you came along with the investigation from your side. And by that time, I think in September, I had already resolved that, I need to go and do articles, even if they don't pay.
Okay.
Before I leave, I'll have to take a loan so that I can go do the articles.
So you were already planning your way out, sort of, and then it just...
Yes, no, because you see, when you deal with the corporate psychopath, it's like we are dealing with the narcissist. They said it's either you die or
get out.
Yeah, because you will not. It's not in their nature to lose.
Okay, but apart from all of that, the internal stuff, the job itself, did you find it fulfilling? Like, where were you going? What were you doing?
No, the job was
Very
nice.
interesting, right?
It was quite interesting, especially the Section 41A, because the Section 41A is where we start the investigations. And like in my office, I was responsible for the deaths, for high profile cases, the cases that are in the media, the sexual assaults, and those cases that need to be reported to in terms of what's that legislation? Combating crime.
PRECA.
Yes, in terms
prevention
of PRECA. Yes,
the corrupt activities, all that stuff.
Yes, because remember there is this criminal activity that goes between doctors and the medical schemes.
Okay, so just let's slow it down a bit, because there's a lot of lay people that watch this show also.
Okay.
So like, as a chief investigator, and you're talking about Section 41 investigations, that's when somebody complains or there's a complaint that happens. How does it, and what happens? Like, just explain it for even medics don't really know.
Yes.
Right?
Section 41A investigation is where the registrar of counsel.
Yeah. That's the regulator. That's the HPCSA, the regulator.
The CEO of the HPCSA initiates an investigation. Then ordinary investigations come through complaints.
Right.
You know, there's complaints handling when they receive complaint
from a patient or something.
If it's a minor complaint about the statement
or billing issues.
Yeah, that one then goes to mediation. If it's just a dispute about the displeasure, then it goes to the mediation. And then if it's something that requires investigation, it generally then comes to the investigation unit.
Yeah.
And now you have
and you're the head of that unit at the time.
Yes, yes. What happens then is, if we discover that there is a doctor whom is being quoted in the news for wrongdoing, like there was that doctor in Free State, I think, who was said to have attended to a baby. And I think he operated on the baby, and when the baby did not wake up, the baby who had actually died, he put the baby on the mother's back and tell them to go home, and the baby is going to wake up.
Sure.
And then there is also a case that I had to follow on, where I think it's the son of the deceased went viral about the treatment that they got from the Tonga hospital. Okay, so on social media and things like that. Yes. So this is all like it's initiated by the registrar. Nobody has to come and formally complain and say this is what happened. If you come to formally complain, then the complaints handling people will then sit you down and record, fill in the forms properly, have you sign, and then they process it. This one is started by us. But although, am I right that on some occasions a complaint can then trigger a process to your office also, potentially? Yes. Then, like I said, where there is death, there's sexual assaults, there's the high profile. I think there was one of the politicians who is also a doctor. That then there was a girl or a makwapeni who complained about being harassed or assaulted by that doctor, who is also a minister or deputy minister. Yes. Then that we had to handle. It's all high profile stuff and big things. Yes, and the civil aviation doctors. We also need to deal with those. So you saw interesting things. Yes. So apart from all the side show that happens. Yeah, in any corporate. It makes you fear doctors.
I was going to ask this. Doesn't it make you a bit despondent? Like, don't you start to think now, is the whole industry like this?
No, I know for a fact that it's not the entire
Yeah.
industry is not like that. Like I said, we have our family GP.
Right.
We have good doctors. We have good fellas that I went to school with.
Of course,
And
yeah.
there are other guys that I have met who have done wonderful jobs. But the reality of the situation is that not all doctors are good, and that's a fact. And that is why we have the Health Professions Council to try and get everybody in line.
Yeah, and you get exposed to the bad ones a lot.
Yeah. And that's where
that's just the nature of your job at the time.
To say, I mean, even in a home, you can have your 5 or 10 children. Not all of them are going to excel. If they do excel, then you're lucky one. But there is one who's going to be a tsotsi. There's one who's just not going to want to do anything, and there's one who's end up doing drugs. It's
human.
It's life. It's this balance.
Okay. So then I come along.
So you come along when these guys start rocking my boat. You come along, and that's when you started then discussing, like, you know what, because I'm in the middle of this serious matter. Let's pack it. And once this case is closed on my side and I've handed the report, then we can have a discussion.
I always joke with my friends that I should have been in recruitment, because there's something I just enjoyed, like connecting people, and I thought you would have made a perfect fit, because that firm, does medical defense work, and it would be ideal to get a lawyer and a doctor in one.
And I think it's unfortunate, like I said, that if you are employed, just know that your employer is not going to give you what your money is worth. Maybe less than 0.5% employers will do that. Because what you did for them, they should have paid you. Unfortunately,
yes, I agree.
I couldn't pay you because I was the most broke person at the time.
I agree. They should have paid me.
Yes, because I think must also give credit to Donaldini and the team that interviewed me, and him being able to say, you are an adult, you are a doctor, and now you are here. You went through all this thing without even having done the actual practical work, but please lead the way. Go to Eastern Cape on your own. Have a meeting with counsel on your own. And
when you talk about counsel this time, you mean like an advocate as counsel, not
both the advocate and the senior counsel, and you sit with them, and you have to explain things from the medical perspective, and then you come into law, and you think, you know what, when these guys want to dismiss the fact that I've got the wealth of knowledge, being a medical practitioner, having been on the forefront, being in the management, and you say you want to treat me financially, you want to treat me like somebody who just left VETS or UCT, I think the HR is failing, because, like you say, you correctly say, you have an eye for talent, and that's supposed to be recognized. Now you are having people who know very well, but they don't want to recognize whether, I think, just to summarize, the worst thing that an institution can have is a jealous human resource manager.
Good point, yeah.
Because your job, once they say your job is recruitment, and you have recruitment has got two components. It's recruitment and retention.
Yes.
And the retention is based on talent. And if there is such talent, then you need to meet that talent halfway.
Yeah.
Because there is, I don't think there's anybody who can go to a company and said, I want to earn 10 million without even having shown anything. But the feedback that you get from the directors should tell you that, look, this guy, he knows the medical management, he knows the management of hospitals. And now when we deal with the patients, and we have records, like I think Donald asked during the interview, that now that you're investigating these guys, are you going to be able to defend them? And I said, if my job is to defend them, then so be it. I'm going to do exactly that. So,
and the funny thing is, in the story that you and I just spoke of, like your life story now, you did do that. You defended a colleague.
I had to. No, yeah.
And you probably didn't even think about it in this interview to even think of that situation, right?
Yeah, no.
Because an interview is
now that you're saying it.
Yeah.
But then, yes, again,
that's why I don't like interviews, man. Because interviews, they don't unpack all these things. Like, and if you forget about that moment, imagine how nice it would have been for you to be able to say, yeah, Donald, I've even done it before. There was once a colleague that was charged with this, negligence for a debt. And I looked at the record, you would have blown them out of the water there.
Yeah.
That's why I don't like interviews like for jobs, because it's a snapshot, man, if you don't perform.
But trust me, yes, the Norton Rose interview was the best.
Yeah.
Because I think even the approach, when they say we need to chat, that's one thing that I like about white folks. They are not stuck up.
Okay.
When you go to government and they structure the questions and to their level of thinking and to their train of thought, and they expect you to then find or answer along what they think. Like you said, sometimes a person may have a tunnel vision. When you now bring a spectrum,
influenced by your own experience,
yes,
right.
Then it becomes difficult. So after I shared my CV, I think I was doing an investigation here in KZN, and then they gave me directions to the offices there.
In Sandton?
No, La Lucia.
Oh, you went to the La Lucia office, yeah?
Yes. Then I went there. I forgot who the director is there.
Who, De Niro, Indian guy, or?
No, it was not De Niro.
White,
it was a white old.
Craig Woolley.
Yes. I sat with him, and then the other three directors said, I think Brent was there, Donald was there, and who's the old man?
Which one? Michael Cronus, Patrick Bradshaw? From the Joburg office?
Yeah.
Or from...
No, it's not Patrick, and it's not Michael Cronus. Which one is Michael
Mike, the big guy?
No, not him. The other old guy who uses the wheelchair.
I can't remember. Oh, David Kapelis. David Kapelis.
You cannot afford to.
David, yeah.
Yeah, you can't afford to forget.
I think he'll take exception in calling him old. David Kapelis.
Well, it's what I saw from the clinical eye.
Yeah, senior.
Yes.
I hope he watched. I'm gonna send him this portion at least. Yeah. So were they there in person? No, they were on video.
The three guys from Sandton plus HR were in on
video. Yeah.
On video, and then I was sitting with the director, the fourth director.
Yeah.
Then we had a chat. It was more of a chat to us.
Yeah, well, you were saying, that's what you like about white folk. They don't have tunnel vision, but you're giving them too much credit. I just think Donald asked the right questions, and clearly.
No, but the point is, like again with the talent management, recruitment, and retention, you need to know what you're looking for.
Right.
And once you found it, it's like when you go for interviews for masters, they don't ask you what are the 7 colors of the rainbow, the 6 colors, whatever. No, they want to understand you, to know you, and then to know your support structure. Because already the CV has spoken. Yeah. So that was the chat that we had. And then when Donald asked them, like, no, it's for me, it's easy. Because the job requires for me to do this, and rising to the occasion has never been a big deal to me.
Nice, man.
Then what happens is I submitted, I think on the 9th of December. This is when I upset. In the street, we say when I pissed them the most.
Yeah.
I wrote another grievance that now implicates the CEO and the head of legal for favoring this guy, and for also the one that they're paying over 2 million for that lesser job, and for also transgressing the rules and the policy in terms of the acting, and again in terms of the payment, to say there is a policy on equal work or equal pay for work of equal value, to say you guys are acting illegally and you are cancelled. And then I copied the president of the council. So those the guys, I think by that time I had received the contract from Norton Rose, but I had not yet signed it. Then between I think the 9th of December and the 15th, there was a Sunday where I felt, you know what, let me sign these things because I've got a bad feeling about this whole shebang here. So I signed, and then on Monday morning I called the lady from HR. Is it right?
Yes.
Yes, I called her to say, I've sent you the contract, and can you confirm? Then by email, then she confirmed. Then I'm like, okay, January, I'm starting at Norton Rose.
Moving to Santon.
Yes. And then the following day, these guys then sent me a notification that they are terminating my probation is not going to be renewed.
Okay.
I'm like, well, seems like I had an idea, and I'm at peace.
No surprises there, yeah.
Yeah, so I'm at peace.
And then how was articles in a Santon law firm? What was the experience like? This was the first time in Santon. Now you hadn't worked in Santon before, obviously.
Yeah, I don't like Joburg. I've never liked Joburg.
Yeah.
So
it's too chaotic.
No, the traffic, getting there. And getting out of there.
What was your experience like? What was the first day like?
I think the other advantage that I had was that I think the first 20 days there was nothing happening, or there was orientation for these ones who come from school.
Yes.
And I was given a pass to say, you are an adult, so most of these things we need to settle these guys who come from all these corners of the country, the offices, so you can start on the 20th.
Okay.
But on the contract, then it's the first.
Yeah.
So then starting there, it was quite nice environment. And then yes, I was told that my immediate supervisor will be Donald. And then I saw you in person. I'm like, hey, yes. And then I saw I think Relebohile, there's Shabalala, there's who's this Kilebohile, and the other folks, and work was nice. And then guys kept on asking, and you kept on making my life a bit difficult.
Yeah.
When people asked you, and then you say, no, I'm not the doctor. Here's the real doctor. Yeah. And then the guys were quite fascinated. So you left? Yeah, why?
Why? Yeah.
You know, I wanted to become a doctor, but my results let me down. I'm like, I always wanted to become a lawyer.
It's weird. Huh?
Yeah. So then, with the medical cases, then every now and then guys will come and ask, what is this? What is this? What are these acronyms and all that? Then you assist. And the first 2 months, it was a bit weird. Now we're going back to English and refined English. You know how Donald
like
writes. And
I don't think you can call that English, Donald.
No, this is Donald Dini, so you're right.
By the way, you know that Donald Dini, right? If you are placed with Donald in your first rotation in articles, it means that they see something in you. This is what I was told. Because Donald is a notoriously difficult director to work for, because his practice is just so busy and high-paced, and it can lead to tears. So they put the person with him that they think is going to survive. So it's a good sign. Yeah, obviously.
If that's a compliment, thank you.
Yeah, it is a compliment. Yeah.
Yeah. So working with him, I think the first 2 months,
You survived.
no,
You thrived.
I thrived.
Yeah.
The issue was when he made corrections. I'm like, now I thought I wrote English, and now he's correcting my English.
Yeah.
Which English must I now?
Did you get Patrick Bracher ever to look at your stuff? No.
No, you did. You did tell me
Yeah.
to send to him as well.
Yeah.
But with
They will humble you.
with Donald alone, it was sufficient.
Donald.
And remember, in June when people were rotating, I didn't have to rotate.
You stayed with Donald.
I was told, no, you are to
shame, man.
Stay with this man for the whole year.
You're stuck with Donald for a whole year.
No, it was love. No, it was love.
Nah, I'm joking. Best. Donald was my first. I did articles under him. He was my first rotation also. And that's when the HR lady told me about the story about Donald and, how they give it to somebody who can survive him.
No, we got along.
Me, my rotation, I was like, no, I made a mistake doing law. I didn't understand what was going on because it's higher grade insurance stuff that he does a lot of the time. But do you know that somebody's written an article about him? It was in the Daily Maverick. It's called something, My First White Boss. You must go and read this article. It's by Lwando Paso.
Yeah, please send.
I'll send it to you, and you will be able. You'll relate. It's such a lovely article. If somebody could write an article about me one day like that.
No, he's a good man. He does not speak a lot.
Yeah.
If he speaks at all.
Yeah.
But when you having a chat with him, it's marvelous. And when you deal with the law, then like, no, I'm dealing with a genius. This guy is, and with his colorful sneakers. Yes,
and he's got that wicked sense of humor, dry sense of humor. Sometimes you don't know if he's joking or if he's being serious.
No, you just have to look at how far his
you never know.
His smile goes. Then you know, and the walk.
Oh yeah, it's very fast,
pacing through that sentence city.
Oh, did you also follow him through to council? Go to council one.
I had to.
I'll never forget. Hey, one time I walked with him through Santon, get to council's chambers. Now I'm dripping with sweat because I'm unfit.
Yeah.
And Donald is the opposite. And then there was a senior counsel and junior counsel in chambers. We were consulting with both of them. And the junior, Tsakane, he said to me, "Hey, Yash, did you walk here or did you swim here, man?" Like, what? Terrible. Donald. And I said to Donald, "No, I'm never walking again." Yeah.
No, he's such a lovely guy. And remember, I think we went, and then I don't know what, or COVID came.
Oh yes.
Then we had to arrange now for if it does happen that we have to work from home. And I think when the announcement was made, we were in that group that was now working from home, and that changed things. And for me, it was a blessing because I spent 5,000 a month just to travel from Pretoria to Santon. And I think the first week, I used my car, and the certain engines don't require for you to do short distances, otherwise you're going to gasp. So then I switched to Gautrain.
Okay.
It was not cheap either,
yeah.
But it was quite convenient, and it allowed me to walk from Gautrain station to the office and back almost every day, which I was very fine with it.
Yeah. So then the articles is 2 years.
No, I remember I did 1 year because I had done my PLT.
Okay.
I had done my PLT, I had written my exams. All that I needed was that 1 year. When they talked about the 2 years, I discussed with them that I'm very clear with what I need in life, and besides me staying 2 years here, it means I won't I won't be able to afford. So at the end, I think it was October, November, when the discussion started with regard to retention. And when we had a discussion about that, then I reminded them, because initially when we had that meeting, when I was in Durban, about joining the team, they asked, "So do you have any question?" Then I asked, "Now, in terms of the salary. I said, no, I have a family and I need to be able to I don't want much. I just want to be able to maintain the current lifestyle. And then they said, no, it's fine. Send us your salary slip and then we'll match it. It's fine. And unbeknown to me, when HR saw it and then they turned it down, they said, no, we won't be able to pay you this.
Yeah.
But we know the truth. It's not like they could not afford. They spoke some things that said to me, this is not, these are not the right people for recruitment and retention. But anyway, for me, I said, whatever they're giving me, it's far more than what I will ordinarily get, because to start with, I was willing not to receive a pay just to get the articles.
Yes, of course. Yeah.
And something that people that will not understand is that that year of sacrifice was worth more than R1 million for me. So it cost me, I paid 1 million to do articles with what those guys were paying.
Yeah.
And when people ask you then for advice and legal advice, and they say, can I pick your brain? I'm like, no, you can't.
Yeah, it's worth a lot.
It's a lot.
It's got value.
Yeah. So at the end, then we start talking. Would you like to stay? I'm like, look, if I have to work with Donald, then I will definitely stay. And surely we're going to discuss the issues of money. And then when we discussed the issues of money, I told them, like I said, I don't mind spending another year or two here, but not with what you are giving me or whatever you're thinking you give your first year associates. Because I'm doing, you understand that I'm doing medical law in the real sense of medical law, medical litigation. I have an understanding of clinical medicine, and that includes management and forensics. And the things that I discuss with counsel and discuss with the team are the things that are, some of them I've acquired them over a period of 15 years. This is my reality, nobody else. Because I would see it with the specialists, they'll bring a pediatric specialist and then we discuss the case.
Yeah.
Or they bring the obstetrician, we discuss the case, or the surgeon. I have to go and do the clinical notes. I have to read those clinical notes and check everything against what this person's opinion is going to be. And then when they are giving us the untruths, then I will call them out that this is not the case. You need to know the difference between CRP, ESR, and PCT. And now when you are an advocate and you're taking a brief and this person speaks of these things and they mislead you, it means you need to then go and do research. But I'm sitting here and I'm telling you, no, but this cannot be correct, doc. Can we review the position? What are you saying? Because even the chronology of this matters does not make sense. I'm saving the company the time of now getting a second opinion and all that, and you don't want to pay for that because you are saying I'm a junior associate. You are not appreciative. And I said, look, at the end of the day, and I think that in our last meeting, I said, look, if you cannot pay me for what I am worth, then I would rather go and serve public, because the public is worth every cent that I'm worth, even though they cannot pay me.
Very good point. Okay, wait, hold on. So you left Norton Rose end of 2020.
January 2021, yes.
And you went back to state.
I came here to do forensics, yes.
Oh, so you're working in the forensic pathology department. What's it?
Yes.
As a MO.
Yes.
And you're doing autopsies and things.
Yes.
Sure. From legal work to then cutting up dead bodies and checking the cause of death.
Yes.
Sure. It's fascinating,
It's interlinked.
Fascinating.
If you think about it.
Yeah. Explain that.
I I think the whole of this year, I was doing a presentation, a series of presentations where titled "Medicine is Law,"
Okay.
because our practice is founded in law. The forefathers, they studied the art, but then it got regulated. Then it's now based on law. There are more than 32 acts that we actually put in practice when we practice medicine. So with forensic pathology, we need to determine the cause of death in terms of the Inquest Act 58 of 1959. I think, and that's the same one that I used when I tried to open that criminal case in 2016.
Yeah.
To say, in terms of Section 2, a person who believes that the person who died not of or other than natural death has the duty to report to the police. And in terms of Section 3, the police have a duty to open a case and cause for the body to be investigated by a qualified medical practitioner.
Fascinating.
So from opening cases, and now I'm doing the actual autopsy. And this is for, remember, the representing patients or the medical litigation, you either represent somebody who has already died through their estate, or you represent somebody who is alive but is suffering from the consequences or the complications of the medical intervention. Now, this is where you see the surgeons and the hospitals contribution to the demise of patients. And you also sometimes you look at the forensic from the academic perspective, where you need to do the autopsy, and then because the people who were dealing with the patient, they have interest in the matter. Sometimes you have to perform an autopsy because the family does not believe that this person died of natural causes. They have the right to request an autopsy.
Is there a difference between an autopsy and a post-mortem?
Yes.
Yeah.
A post-mortem is an umbrella term.
Okay.
You can do a post-mortem without doing an autopsy.
Right.
An autopsy is about doing the actual dissection of the body.
And what's a post-mortem then?
A post-mortem, like let's say, when we're having a skeleton from the sea, there's nothing to dissect.
Right.
So that is a post-mortem.
Ah.
When you're having a person whom is not known whether this person, how this person died, and you get the history from the family that, no, this person had 1, 2, 3, 4, 5.
Yeah.
Then that is post-mortem, because it's an investigation after life. That's basically what it is.
But you don't need to dissect necessarily.
Yes, it is that's this way we always talk about the doctor's discretion. You decide, and sometimes you will have a body that is so destroyed that, these people who, whether it's homicide or suicide on the train, and all that you have is a crushed body. You look at that, and you then.
And when do you have to dissect?
You have to you dissect when you are of the opinion that there is something to find, or you are not sure about what is going on. And in most cases, surgical cases, you go and dissect. Medical emergency cases that had a hand or intervention, or they stayed in the hospital, or there was a delay, whatever the cause, and then the violent traumas.
Mm-hmm. So any unnatural death, am I right?
Autopsy is about unnatural death.
Yeah.
That's why I said there's a natural deaths, they deal with them there.
Yeah.
And then the natural deaths that come to us because there is no place to, like an unknown person that comes to the attention of the community, and it's unknown, and therefore the family cannot be called, we become a temporary custodian.
So you just keep the body there.
We need to certify that person.
So all your patients are all dead? Huh?
No.
All your patients are dead? No. Yeah.
Yes, I'm doing forensic pathology. Of course, they're all dead.
It's
I deal with
amazing.
the dead. No, and I think we need to correct. But they're not called patients.
Yeah, what do you call them?
It's cases, because we get cases from the police.
And is it not like, does it not creep you out? So you're just dealing with dead bodies every day?
Yes.
And you're okay?
I don't know. You tell me. Am I okay?
Why did you get into that? Was it just by...
No, it's like I said, I went to HPCSA for a reason. I wanted to know what the counselor does. And then when I came to forensic, it was a build on.
Okay.
To say, once I sit and I have enough capital to say, now let me start working, then I know I can deal with the deceased, I can deal with the living in terms of medical litigation and all that. And
the newborn. So you've gone from beginning of life to end of life, basically. You've covered it all.
And the complications that comes after life.
So what's the plans? What's next? Because remember, you told me you get bored very easily. But you've been here for a long time now. How long now?
I spent 3 years in the South Coast, and I think on my anniversary of that 3 years, I had told those people that because they said, we like you, we hope you stay. I'm like, no, I'm not an avocado tree, so
you're a nomad.
I'm not going to stay. Yeah, they were disappointed, but ultimately after that, I said to them, I'm going to spend 3 years. Basically, I had told myself I'd be in this for 3 years, and after that, I'll be able to be on my own as an attorney. But things work differently.
So is the plan to now be an attorney again?
Pardon?
Is the plan to now be an attorney again? After
yes. This? No, the plan is to ultimately, I need to be able to sit and deal with medical legal. No, I'm not going to derive anything over and above what I'm doing at forensic.
And when you say medical legal, it's not necessarily defense work.
No, a client, we deal with a client. Sometimes you defend, like we did at Norton Rose, we're defending the client. But if I'm an independent, then I deal with whoever wants to be represented.
Wow. Okay, so that's next on the agenda then.
Yes.
One of these years. Wow. Sure. Hey, but it's a fascinating life and story that you've got, man.
Yeah, it's a long, hectic life.
But how old are you? You said people think you're old, but I feel like, having spoken to you now, I feel like you're younger than I always thought you were.
It's a pity you're not a girl. I was going to blush.
And so, but then once you become a lawyer, then you'll end up in politics maybe one day. Not really. Not really.
Not really.
Would you be Minister of Health if somebody invited you? Would you ever be interested in that?
Yeah, I've been asked that question, but unfortunately, the people who ask me that question are not powerful.
Exactly, not in a position to put you there. Yeah. But if somebody who
it's said, yeah, I think it's something that I can take up. But I always believe, because growing up, I taught myself this, in that in order for you to be a good leader, you must start as a good follower.
That's deep.
Go to the ground, get your hands dirty, know the job, so that when you are up there and you tell people what needs to be done, and when you call for the frog and then they give you a red, you must know the difference, so that when you reprimand, to say, please don't play that game. This is what I called for.
Yeah, it's informed decisions that you're making based on experience.
And the unfortunate part is that it takes time. It takes time for you to gain this knowledge.
Yeah, there's nothing that can replace experience.
Yeah, and there's no shortcut.
What do you do for fun besides cutting up dead bodies and things like that?
What do I do for fun? I lived with my daughter here, so
How old is she?
10. She turned 10 this year. Then in the morning I'll take her to school. Then I go to work in the afternoon. Fetch her, and then we come home. On weekends we either go to the beach, for her to swim, or we.
Can you swim?
It's been but the Lokshan, the township swimming.
Yeah.
But
But you can survive. If thrown in water, you can survive.
No, yeah, that's why I've got a pool. Go in there and come out.
Will you be okay?
No, I can swim.
Because the previous guest that I mentioned, who was also the sports haka,
Mhm.
Kefus, we once threw him in a pool when we went on haka camp. And we thought he was joking. The guy started floating with his face in the water. After a few seconds, we realized the guy's not joking. So we had to jump in and pull him out because he literally cannot even keep his head above water.
No, I can swim. You know, in townships, when there's streams of water, even in the villages, the streams of rivers, we go there and you, as boys, you learn how to survive in water.
Okay.
So that's how, and then as you grow, then you also learn some few tricks.
Okay.
And that's also how I taught my daughter how to swim. Then once I realized that I think my scope is done, then I take it to the professionals. And then she goes to school where she also learn.
And your favorite genre is Maskandi music?
I listen to all kinds of music, be it jazz, be it orchestra, be it what do you call?
Do you listen to like gospel stuff? And
Yes, I wanted to say gospel. I listen to it, yeah, but it's got every other music I listen to. But I remember when I was in Tekis, for the when I had the orchestra for the first time, I think it almost threw me into depression. And unfortunately, it was not my car. Didn't have a car then, so I'm sitting with this two guys who were driving to Kalafong, and they playing some very dull. It's like some demon is coming into the car. Okay, kill me once.
Yeah.
Nowadays I listen to what Christopher Tin. I listen to.
Do you listen to podcasts by any chance, or watch any podcasts? Not really.
Not really.
You need to subscribe to this one at least.
No, yours. I catch those snippets that you do.
That I force on everyone. Yeah.
Yeah. The one thing that I do, and I think I'm going to do most of it, is with Adobe. They now have that audio version, you're able to switch to audio, the acts and the regulations. Yeah. So when I drive a long distance, I also just switch into that, and I listen to the act, so that when I get to the end, then I know what the act is about or the regulations about.
To the law. Sheesh. And you stay awake that whole drive. Wow.
No, that's one of my. I used to say, if I make good money, I must get myself a truck. Then I can live in Pretoria and then do long distance, go to Cape Town and for a week, and then back, do the cargo.
And listen to legislation as you drive.
Yeah. Now you listen for like about 3 hours, then from there you switch to music, and then hip hop. Then you.
No, well, if the law doesn't put you to sleep, then you can at least do me the least of a favor and listen to my podcast.
I will definitely.
We always ask this question on the show before we wrap up. And you mentioned 10-year-old daughter. I don't know if she's given you any insight into her inclinations, but if one day she comes to you and says, Dad, I'm thinking of doing medicine, do you have any advice for me? What would you say to her?
Well, this is one thing that is fascinating about my daughter, and In isiZulu, they said ufuze work.
Yeah.
They take most of your trades.
Yeah.
She told me very early that Dad, she calls me, say what? Say what? I want to be like you.
What does say what mean?
Okay. Back in 2017, she is born 1st July. So the PLT started on the 3rd of July.
Yeah.
And then on the 1st of July was her birthday. And then the 2nd was the day before I left. She was about 2 at the time, so vocab was not that strong. And we were sitting in the bakkie, and we were playing Rick Ross,
Okay.
Austin Martin.
Yeah. Aston Martin music, yeah?
Yeah.
Say what? Okay, like that.
Then I'm like, say what? Say what?
Okay.
Now, at that time, she had not, because she sees me every day, she had not formulated a name that she like the father, dad, or in any language. So then I left for Howard College. And then for 2 weeks, that's the last thing that she knew. And then she kept on asking my cousin and her mother, where is say what?
That's cool, man.
Guy say what? Guy say what? And they because this is a child, you don't know what language she speaks, because the mother speaks Zulu, my cousin speaks Tswana. And this child keeps on asking this question. And she, at that time, she was not even attending creche and stuff. Then I come back after 2 weeks. Then she points at me. Yes, say what?
Cool,
So,
man.
all the way until now. Yeah, she said, when the child says, I want to be like you, then she's basically saying, please act right. Because I want to be a lawyer, and I want to be a doctor, and then maybe I also want to be a teacher.
Wow, man.
Can I do all these things? I'm like, it's quite easy, but you need to know that you need to put in the work.
That's fascinating. Cool, man. Say what? Rick Ross inspired nickname for you. Man, thank you so much. Dr. Tsametse Mohlamonyane. Tsametse. It was fascinating, man. Maybe we speak again in 5 years. Who knows what will happen? Maybe you've got your own practice.
Yeah, I'll be 50 then. So I think I'll invite you to my 50th birthday.
Thank you so much. Thanks a lot. I appreciate the conversation.
Thank you. Thank you very much.
Sweet.
Thank you for coming.